You can inject volume with the needle or with the cannula. I published some year ago with my dear friend Rajiv Grover, that I had the pleasure to meet here, a technique by the mouth, entering by the mouth with the cannula, but you can perform the same result with the needle. And I will inject in my draw, and what I will do is to go directly over the bone. You cannot go over. This is the bone. I go with a 45-degree over the bone, and with my left finger I feel the implant while I push with my right hand. The lady doesn't like a complete transformation of the face, so I will inject less than a complete dose, we could say. So 1 cc per each side. So she will get some transformation, but not very evident. It's a 23 needle. I go behind, always directly over the bone. I can overlap the bone, and I inject. No side effect, some swelling for a few hours. It's very rare, some hematoma, but it can happen, of course, and it's not a problem. I injected 0.6, 0.7 on this side. That's very not a large amount of substance, and I push with my hand and I get a molding message. If you see the difference between one side and another, can you sit, please? Can you sit down, please? Okay. You see the difference between this side and the other one, but when we clean, the difference will be great. Okay, go down. I change the needle. I go over the bone. After that, I give an inclination of 45 degrees to the syringe, and I feel with my left hand what the right hand is doing. You pin. Patient is really perfect.
Excuse me, would you consider any injection over the medial cheek?
Injection where?
The medial cheek.
Here?
Yeah.
Yes, you mean?
No, not the nasolabial fold, or the medial aspect.
Yes, I did before. I did before with Juvenile 3. And raising up the malar region, it will improve a little bit. But we have a check after, and we consider this. We could have. Okay. She needs some more on the left side. And we will finish with the Juvenile Multa 3 in the eyebrow.
Excuse me, do you worry about the zygomatic branch of the facial nerve when you're...
No, I don't care about the facial nerve because I am exactly 1-2 centimeter over the facial nerve. The facial nerve emerges from the parotid gland, about 1 centimeter from the tragus. I am much more. I am here. I can find the facial nerve. And anyway, if you only touch the facial nerve, patient feels something, and you know immediately. But I had an experience of about 800 cases. And I crossed my finger. I never met the facial nerve. So it's a very safe procedure. It can happen, we can consider, but patient immediately jump up so you know. And if you only touch the facial nerve with a needle, nothing happens. The problem is if you cut some fiber, but it's impossible. Facial nerve is here.
The zygomatic branch?
No, it goes up. No, it's very... I never heard about this, and I consider not very easy to happen, really. Not so. Anyway, you can use the intraoral approach. You can go upper to the third teeth with the cannula. You push the cannula. You slide over the bone. You don't meet neither the facial nerve, neither other structures, neither important structures, and you can inject. I consider it easier and more safe, but it's not for every doctor that has no surgical practice. I mean, so you can try. It's really, really very easy and very safe. But maybe you have to go through the gingiva, through the mucosa, and it's very normal for dentistry, for maxillofacial doctors. It's very uncommon for aesthetic medical doctors, but you can use it. It's very, very, very comfortable for the patient, no bleeding. But you know, in medicine, you never say never. So the correction of eyebrow, I can't correct the position of eyebrow. I shouldn't need some other substance. You can understand which one. And what can I do is to give some more thickness to the eyebrow. It's very, I pinch the eyebrow between my finger. I go in. And I inject a little bit.
Excuse me, what are you using there? 2, 3, or what filler?
It's a Juvenile 3.
Juvenile 3.
Yeah.
Are you sliding it over the bone?
Yeah. And after you massage, you stress the implant. That's it.
How many mil?
0.1, 0.12, 0.1. It gives more depth to the eye. I consider it a joke. As well, if the patient doesn't like, in 4, 5, 6 months, it goes away. So, but they like. What's important is to inject only in the tail, not in the body of the eyebrow. Otherwise, you will have a severe view, and it's not nice. It's not painful. It's easy to do. Okay, now we have 0.6 of Juvederm. Never throw away Juvederm, so we can, according to the doctor, we can perform something more here. She has anesthesia since the previous injection. Sorry?
Her skin above her eyebrow is quite tight, but
About the eyebrow?
yeah,
I can't see you. Can you raise your hand? Oh, sorry. Yeah.
this lady's skin above her eyebrows is quite tight, but some people have very lax skin and they ask for this eyebrow procedure. I normally refuse. Is that the right thing?
I can't hear you. Can you have a mic?
Right. Can you hear me now?
Yeah.
This lady's skin above the eyebrow is quite tight, yes? It's
Yeah.
quite nice skin.
Yeah.
Some people have very loose skin, you know, because the eye, because of age, laxity is lax.
Yeah.
Can you still perform the eyebrow with the filler, or will the filler move if you put it in people with lax?
If the filler move, you mean? No, I don't think the filler move here. It's only to give some thickness, and you can perform it when you find eyebrow. If they have low eyebrow, you have to lift eyebrow this way. You can perform with other substances, with the toxin and or surgically. But if they have a right position in the frontal region, that must be with the right highness, you can perform, you can give some thickness. That's That's the effect. It's not an eyebrow lifting. It is not. It's only to give some thickness, to give some more shape to the eyebrow. It's very useful if they have a tattoo. You can give more thickness. That's it. It's not a lifting. You can perform lifting with surgery or some other. What's really comfortable with Juvederm, it's that's a fluid, but not water. It's the right consistency of the filler. So it's fluid, you can push. There is a new system whose name is Easy Flow, so the syringe is very comfortable for you and for the patient too.
Giuseppe,
Yeah?
has this lady had Botox in her forehead?
Sorry?
Has she had Botox in her forehead at all?
A year ago.
If I have Botox?
Has she had Botox?
No, she didn't. Before, you mean?
Yeah.
No, she didn't. You move your forehead? No.
I've had a year ago, I did.
You had in the past,
A year
Last
ago.
year in March.
in March. In March now?
No, last year.
Last year. So you can't get any Botox now, I suppose. Or you have a special one.
We have, in this country, there are a few non-medically qualified individuals with no medical training
Yes, I know.
doing this treatment. What's your view on that?
We don't. It's not allowed. Only
Really?
doctors.
And why would you? What's your view about that? Why would you feel?
What do you think?
I know, but well, I'd get a quote.
We have to be very diplomatic.
Don't be diplomatic.
Don't be
I
diplomatic.
don't want diplomacy.
I am authorized not to be a diplomat. Well, I travel a lot all over the world. So in UK and in Australia too, I met wonderful nurses, very able to perform this treatment. Of course, I think they are more technical than we that study the problem. In a technical way, they are absolutely able to do it. It's not, I mean, it's not something really.
We're not even talking about nurses. We're talking about people who have never.
Oh no, only qualified. I mean, I never.
So we're talking about people
We don't.
therapists who have never.
No, I never met such.
No, this is a problem.
No, we do not in Italy and in the rest of Europe. It's not allowed neither for nurses.
And what clinical reason would you say that it's? Why would you say?
Maybe they have not a clinical background. If you have an allergy or if you have some problem, you cannot solve it if you are a doctor. And sometimes if you are a doctor, it's difficult for you too. And to manage adrenaline or atropine for a vagal syndrome is not something that everybody can afford. So it's not a polemic. I mean, it's our custom in Italy. It's only for doctors. And the Botox especially is only for qualified doctors. So you have to follow a course and so on. Fillers, every doctor can perform filler in Italy or all over the world, I have to say, except UK, Switzerland, and Australia. But doctors...
Describing nurses over here, so nurses who are able, which obviously I think they're highly trained actually, but then we do have a lot of they call themselves injection specialists who have no medical training.
No, I think you have to do something. I think you have to do something. And it's not permitted everywhere. Only doctors in the world and nurses here. It's a problem of background, to solve problems. Sometimes patients are very delicate. You do injections and they go down because they are afraid. So you can have the most common is vagal syndrome. Vagal syndrome could be really dangerous if you do not know how to manage atropine and how to revitalize the patient. Nothing happens, never. But it's enough one.
One's too many.
One's too many. That's the problem, because one for me, it's one for everybody. That's the problem. And you read on newspapers, and she went for a filler and she died. So this is not the case. She's completely alive. I hope she's
Trained, yeah.
yes. I hope she's better than before. So now we have the judge. Could you look at yourself, please, and tell us sincerely what you think? Very sincerely. Don't cry.
Very noticeable here.
Very nice.
Yeah.
What's about your? And you see the eyebrow. You see. I could say my best compliment. Yes, just a moment. My best compliment could be I see nothing.
Yeah.
That's my.
That's kind of what I'm thinking.
Yes, that's my best compliment. That's a compliment for me, a natural aspect. I see nothing. I can go working. I can go at home and no problem. Just some redness here. That's normal by depression of the message. The eyebrow is. I will show you in a moment, and now it's for the patient. Okay, can you sit and show to the colleagues? May I ask you, what's your idea? What will you do to this patient?
Good morning. Hi. I'm just wondering, would this lady benefit from some augmentation of the temporal region?
Yes.
To me,
You mean here?
the 2 week, especially with the fillers you put around the eyebrow.
Yes, it's correct. We could do. I saw you. I told you before, and it's a secret. It's not a secret. I don't know exactly if I can or not, but it is coming in a few days, I suppose, in a few weeks. A new technique that uses micro cannula that are sharp, not sharp, a blunt cannula. 23 blunt cannula means like a needle, but longer than a needle, flexible one that you can insert from one single hole with a needle. You put the needle, you insert the cannula, and you move the cannula, a flexible cannula. It will change your life, for sure. You will consume the double of syringes because the cannula goes into the subcutaneous. But the aspect, the final aspect will be more round. It's really very, very useful for the temple, very useful. You go down with the cannula and you inject with the fan technique. The cannula moves. It's a flexible cannula. They will propose you in some week, I think.
So if you were to do this with a needle,
Yes, I should.
what would your
Oh, you know, here you have vessels and nerves. So I will go down, and after I will raise my needle. Down directly over the bone. And after I will raise my needle. But I should not do a fan technique here. As well, it's very probably you can meet some more than nerve vessel. And you have big hematoma, and it's noising for the patient. So she was very nice before, and I think she's still nice and natural with something more. That's the result that I like. It's very, I could not say because I made it, but it's very elegant, not unnatural, not very evident. Hmm? Do you agree?
Yes.
You have to agree. Thank you very much.
You.
Thank you.